Come in.
Hi, I'm Morgan Pizzo. I'm the physician assistant student who will be taking care of you today.
Hi, I'm Kaval.
Hi, Kaval. Nice to meet you. So, Kaval, tell me a little bit about yourself. How old are you?
I am 62 years old.
62. Okay. And tell me, what's bringing you in today?
Yeah, I've just been having some problems going through the bathroom recently. I've been peeing some blood.
Okay. And how long has this been going on for?
Oh, wow. It's been on for a couple weeks, actually. At first, it was kind of pink sometimes, kind of wasn't, but probably say 2 months.
2 months.
Yeah.
Okay. So you would say that it was a gradual thing that came on, or was it sudden?
It was gradual, I'd say. Like I said, it was off and on in the beginning, but now it's just been like pink. Like pee's been different color like for a while.
Okay. Now, was there anything you were doing right before this happened?
That I can think of. It's regular stuff.
Okay. And was there anything that caused this to be worse at all?
Honestly, I don't know. It's just no, I don't think so.
Okay.
I think it makes it worse, I'd say.
Is there anything that makes it better?
No, it is.
Okay. And has this ever happened before?
Thankfully, it has not happened before. No, this is the first time.
Okay. And would you say since it started 2 months ago, has it gotten any worse or any better?
It's gotten a lot worse.
Okay. And can you describe the quality of, the pain that you're having? Like, is it sharp, dull?
I don't want to say I'm having any pain. It's just
No.
It's just that the color of my urine is different.
Okay.
Looks almost pinkish to me.
Okay. And then the site where this is occurring?
My urine.
And does do you have any like pain or anything else? You're not bleeding from any other sites of your body? It's not radiating to any other parts?
No, it's just that. I think besides that.
And on a scale of 1 to 10, how would you grade this?
Grade this color of the urine.
Like how bad the bleeding is and how bad like your bathroom episodes are.
I think right now it's probably an 8 or 9.
Okay. And has it affected your activities of daily living at all? Have you not been able to do things that you normally would be able to do?
Not really. I think I'm peeing a little bit more than I usually do.
Okay, it's not coming in between like you and work?
No, I wouldn't say it is. It's just that the missus is forcing me to come now.
Got it. And would you say that the bleeding with your urination occurs at any certain time? Does it only happen in the morning or at night? Or
It happens all the time.
All the time.
Almost every single time I go to the bathroom.
Okay. Now let's focus in on this bleeding with urination a little bit. So can you describe the bleeding to me? Like what color is it? How much of it?
It looks like it's, some days it might be darker, but it's usually pinkish.
Okay.
If I didn't drink enough water for that, it might be like a darker red.
Okay. And how much of it would you say, the quantity?
It just depends on how much water I drink.
Okay.
It doesn't really increase or decrease with anything. It's just,
Okay. And do you experience any other symptoms when this is happening? Like, do you get faint, dizziness?
mostly just shock from
Okay. Just shock.
my peanut.
You're surprised. And how about, does it affect your bowel movements at all?
It does not.
So now that I have a little bit of information about what's going on with you pertinently relating to your bleeding of your urine, I'm going to go through some other questions as well, okay? So have you noticed any unusual weight changes?
I think the missus said my belt's a little bit.
Okay,
Usually,
okay, so
not
maybe,
too much.
okay, and any weakness, fever, fatigue?
A little bit of weakness than usual, but nothing too serious.
Okay.
No fever or anything like that.
Okay, and how about any skin rashes, lumps, or sores?
No, I haven't seen any.
Great. Changes in hair, skin, and nails? Other than that?
Everything's been fine.
Great, okay. Now, any headache, dizziness?
No, nothing too much. No, nothing out of the usual.
Okay, and how about problems with vision, double vision, blur vision?
Nothing my glasses can't fix.
Okay, do you routinely get an eye exam every year?
Once every year or two.
Good.
And on it.
Okay, any frequency of colds or nasal stuffiness?
Nothing
No.
like that either.
Okay. And how about sore throat, dry mouth?
No, I'm a relatively healthy guy, I'd say.
Okay. Swollen glands or any stiffness of your neck?
Feels fine.
Good. Okay. Any coughing, shortness of breath, wheezing?
I don't think any wheezing or I do cough a little bit, but I think it's a cigarette cough.
Now, any notice of chest pain, palpitations,
No.
high blood pressure?
I have hypertension.
Okay. All right. We'll note that and then we'll come back to that. Okay. How about any nausea, heartburn, or constipation, diarrhea?
Nothing like that.
Okay. Now, any tenderness, leg pain?
No tenderness or leg pain.
Okay.
Legs work fine.
Okay. And then how about any musculoskeletal pain, arthritis, backache?
No, I don't have any problems with my back.
Okay. And now, do you have any history of depression, mood swings, suicidal thoughts?
No, nothing like that.
Okay. And how about any memory problems, paralysis? Okay.
As sharp as ever.
Okay. And then how about any trouble with anemia or bruising?
No, I don't have any bruising issues or anything.
Okay. And no, except like thyroid trouble or excessive sweating?
Nothing that my doctor has never told me before now.
Okay. All right. And can you talk to me a little bit about any medications you might be on that you take?
Ooh, medications.
Prescribed or unprescribed?
Forgot the list at home, but I do take medications for a high pulse.
Okay.
I have like this. The doctor says my bowels are inflamed sometimes, or my bladder is, and occasionally I do take a medication for that.
Okay. You don't remember the name of it?
No. I can bring it in next time I come in, or I'll call you later. But
how often do you take this medication?
it's prescribed to me, but if I feel like things are heating up, like in my like area down there, I'll just take them. But I'm not too good on it.
So you take it like intermittently when you feel an onset of pain?
Yeah.
Okay. And what's the route that it's given? Orally?
Oral.
Okay.
Yeah.
And do you have any allergies to medication, food, environment?
No, I think the doctor said penicillin once, but that was it. Never had it though. No allergies besides that.
Okay. Now we're gonna get a little bit into your history, okay? So, have you had any significant childhood illnesses when you were a child? Measles, mumps, rubella, chickenpox?
No, nothing like that.
Okay.
I think I received those vaccines.
Okay, yeah, so that's the next thing I was gonna ask you. Are you up to date on your vaccinations?
Yeah, I should.
Okay. And how about, have you had any accidents, illnesses, injuries that required you to be hospitalized?
I think a barrel fall on my arm at my old job.
Okay.
But
And where were you seen? What hospital were you seen at?
oh, the one right down the road was it Atlantic Care?
Okay. And that was how long ago?
Yeah, my old job, 4 months ago. They
Okay.
let me go right after that.
Okay. And do you remember what doctor you were seen by?
Dr.
Okay. All right. Other than that, have you had any other hospitalizations or surgeries?
I think once they did something for my bladder to help with the inflammation.
Okay.
Some kind of a DMSO flush. Forgot what it was called.
Okay. So can you tell me a little bit about that procedure?
Yeah. I just remember my bladder was burning more than usual. Went to my doctor and medication wasn't helping, so they did a quick little procedure to cool my bladder down.
Okay. And how long ago was that procedure?
Last time I had it, maybe 2 years ago. I've had it a few times, I think. Maybe a couple of years or so.
Okay, so 2 years ago you had the surgery and you've had it multiple times.
Multiple times. I can't remember the previous dates, but I think the last one was about 2 years ago.
Same doctor each time?
Yeah, usually same doctor.
Okay. Is that Dr. Patel again? Or
No,
someone
this
else?
is my specialty doctor.
Okay.
Dr. Pizzo. Pizzo.
Okay, and have you had any complications due to that surgery?
No. They worked great both times. All the time.
Okay. Okay, so we'll definitely send, if it's okay with you, we'll have to send this visit over to him to make sure he can follow up
Yeah,
with
of
you.
course.
Great. Okay. And then just a little bit about health maintenance. Do you, routinely, you're a little bit older in age, we want to make sure that we do preventative methods to make sure that we can stay healthy and fit. Do you get annual colonoscopies, blood testing by your doctor routinely?
Usually I'm on top of my blood work for the most part.
Okay.
I haven't been to my doctor actually in, probably a year and a half now.
Okay.
No insurance, so I can't go
Okay.
as much as I wanted.
Okay, and you do wear glasses, so we want to make sure that you get an annual eye exam, which you said that you do. So
I see fine right now.
Okay.
Everything.
All right, so we want to keep up to date on that, which I know you're good at now, so let's continue to do that. Okay, so then moving into some family history. Are your parents, are they still alive?
No, they passed away years ago.
Okay, can you tell, I'm so sorry to hear that. Can you tell me, was there any huge medical issue that might have caused their death?
My dad died when I was pretty young from some kind of cancer. I don't remember exactly.
Okay, how old? I'm sorry, continue.
And my mom lived well into her 80s, but she died of cancer too.
Okay, what kind of cancer did your father have?
I don't remember. I was very young.
Okay, and how old was he when he died, did you say? Do you remember that?
I think early 30s.
Okay. And how about your mother? You don't remember what cancer she had, or do you?
She had lung cancer. She smoked her whole life.
Okay.
So I picked it up.
Now, do you have any children?
Yeah, I have 3 kids.
Okay, and tell me about them. Are they in good health? How old are they?
They're not like their own pops.
Okay, 3 kids in great health. That's wonderful. How old are they?
The youngest is 26. I have a daughter who's 32, and then another son who's 38.
Okay, wonderful. And about great-grandparents, alive or dead?
My great-grandparents?
Yes.
Oh, never met them, never knew them.
Okay.
Yeah, they've been gone for a while.
Okay, so you never even knew them. Okay, and did they have any history of the cancers or?
Couldn't tell you.
Okay, no idea. Okay, so other than your father and your mother's cancer, did they have any other major medical illnesses like hypertension, diabetes, COPD?
I think my mom had she had COPD. I think she smoked a lot too.
Okay.
Don't remember exactly what else she had, but yeah, she was a big cough herself.
Okay, all right. So now moving into a little bit more about yourself. What do you do for a living? Or you said you're unemployed.
Now, yeah.
Okay, what did you do before that?
Oh, I work at the chemical company right down the road.
Okay, and what was your role there?
I was a chemical assistant.
Okay, so you worked with different kinds of chemicals.
Yeah, they call them the benzenes.
The benzenes.
Benzene.
Okay, and can you tell me about now? Since you were working with some heavy, chemical materials, did you have any protective equipment that you used or that the job offered you?
Yeah, I mean the last couple of years they've been on it, but wearing those white coats, glasses, goggles, protection.
Mm-hmm.
But when I was a kid working there, they didn't care. It was just.
Okay, so would you say that you abided by those rules or no?
Oh yeah, of course. Once they started being strict on rules, I abided by those rules.
But prior to that, you might have not.
Oh yeah, back in the 80s, everything went.
Okay. And I know you said you had 3 children. Are you married?
I'm married, yeah.
And what's your ethnicity?
I'm a white Caucasian.
Okay. You identify yourself as being of male gender. Okay. Now, do you have any other pertinent medical issues other than what's brought you here today? Do you have a history of hypertension, diabetes?
Yeah, just the little bladder issue been happening for the last 15, 20 years, and then I do have hypertension. I do take medication for that once in the morning. I take that every morning.
Okay. But we don't remember the name of it.
No. I'll send it over.
Okay. And let's see what else. Other things about you. How would you describe your diet? Would you say you have a balanced, healthy diet, or?
Well, the seafood. You seafood, you eat food.
Okay.
Probably lose a few pounds, but.
Okay, so it's important for us to get, normal fruits and vegetables, monitor, those high meals with some, calorically high meals with some good balanced fruits, vegetables, lean meats, correct? So we can try and work on that.
That's a conversation for the missus.
And how about exercise-wise? Do you exercise at all, often?
I used to do some pretty heavy lifting at my old job, but besides that, no, I don't do no exercise.
Okay, so light. How about your sleeping habits?
I sleep well, I think. I'm usually in bed by 10, awake by like 5 or 6 most days.
Sleep throughout the night, waking up at night, restlessness?
I wake up sometimes to pee now. It's been, matter of fact, the last couple of weeks I've been making up a lot more to go pee.
Okay. How about caffeine consumption?
Well, I just have one pot a day, that's it.
Okay. Now, you said that you smoke?
I do smoke, yeah.
Okay, can you tell me about your smoking habits? How often you smoke? How much you smoke?
Just shoot about a pack a day right now, I'd say. Pack. Used to be a lot worse, but I've been cutting it down.
Are cigarettes the only thing that you smoke?
Yes. Marlboro Lights.
And how about drugs and alcohol? How much do you drink, if you drink at all?
I don't drink too much, I'd say. Occasional beer during football.
Okay, so social drinker?
Fan. Yeah, just big Giants fan.
Okay. And tell me, what's your highest level of education?
I finished high school. Yeah, I finished high school.
And then tell me a little bit more about, your living situation. So you live with your wife and your 3 kids?
No, the kids moved out years ago.
Okay.
Just my wife right now.
Just your wife.
And our cat.
Okay.
With whiskers.
Okay, great. I think that's all the information I need for the interview portion of this. So now we're going to move into the physical exam at that